Hey guys, Boris the PA back with another video. I have not posted a whole lot over the summer. I was actually traveling. I went to Israel. Definitely more details on that to follow. It was an amazing trip. I also had this recurrent sinus infection that took me out for a solid month, a little over a month. I don't know what the heck it was. I was on antibiotics twice. It wasn't COVID. I don't know, man. It was pretty bad. So the only thing I've really posted lately is the video last week about the common mistake on the CASPA essays, and then also about the 1,000 subscriber giveaway. I gave away a stethoscope. Joseph Ramirez, congratulations. Thank you so much for following the channel as long as you have. Congratulations on your beautiful new stethoscope. I think you got chrome and burgundy or something. It was a beautiful stethoscope. But anyway, so I'm back in the States. I'm done traveling. I'm back on the grind. I'm working. And I'm back to posting 2 videos a week. I really do want to grow this channel. I know we just made it to 1,000 subscribers. I'm happy about that. Actually, I think about 1,077 to be specific right now. I'd love to get it to 2,000 by the end of the year, maybe January, which means I need to get consistent and I need to stay consistent and I need to actually put out stuff that you guys want to watch. And that means I need to quit dilly-dallying and I need to quit just being random with my content and actually stick to a pretty... Sorry, I'm passing this lady that's going 30 in a 55. Whoa, buddy. And someone's trying to run me off the road. I don't know if you guys see that in the mirror, but man, crazy drivers. Also, just so you guys know how much I love you, it is 98 degrees right now in Syracuse. It's 98 freaking degrees, scorching hot, super humid. And I'm driving without the air conditioning on, with all my windows closed, so that you can hear my voice more clearly and you don't hear all the whooshing sounds from the windows or all the whooshing sounds from the air conditioning. So I am sweating my butt off because I want you to hear me better on the highway, and that's how much I love you and appreciate you for watching my channel. But anyway, okay, to the meat of this video. So honestly, because, like I said, I'm committed to growing this channel and actually making it a physician assistant channel, not just a holistic health, weight loss, whatever I was doing before. I want to make it about being a physician assistant, first and foremost, physician assistant school, because that's, where this channel started, and that is what most of you guys follow me for, essays, interview tips, how to get into school, things like that. So that's definitely going to be part of it. And also, sorry, this lady's driving like a total lunatic. People are driving like crazy today. 2 people tried to run me off the road, and now this other person on the highway. I'm going 65. Chill out. Jeez. Anyway, so definitely going to keep the PA school stuff, keep going with that, because that's what, most of you guys follow me for, and that's what I want to do because I'm good at it. I've been doing it semi-professionally since I was in PA school, editing essays, helping with mock interviews, just counseling people on how to get into school because it took me so long to become competitive. And so... just brake checked her. Yeah, man, she's driving and giving me one of these. It's hilarious. But anyway, and so yeah, so that's always going to be part of the channel. And then also just life as a physician assistant, career stuff, getting jobs as a physician assistant, all that kind of stuff. And also, of course, about my medical practice, being in internal medicine, primary care, and also medically supervised weight loss. Of course, that's what I'm practicing. That's what I'm very passionate about. So that's what I'm going to keep talking about as well. So basically just those 3 things. Not the emotional health, the spiritual stuff, all that stuff. I think I'm actually going to start a second channel for all of that whenever I have time for that. But right now, the channel is basically just going to be those 3 things. PA school, working as a physician assistant, career stuff, and also... this lady just cut me off. Yeah, anyway, she's flipping me off. As we speak, she's still flipping me off. I hope you have a nice day, ma'am. I hope whatever's bothering you gets better. Jeez. Need to prescribe her some Xanax. 0.25 milligrams to start, maybe moving up to 0.5 milligrams. Anyway. Okay, so yeah. Not sure where my train of thought went. I'm trying to focus on the video, focus on driving on the highway, apparently pissing someone off because I'm only going the speed limit or a little bit faster. But yeah, anyway. So the meat of this video. So after I was done with my day, after I saw all my patients, finished all my notes, did all my triages, prescribed all my medications, did all that stuff, I sat in the office for 30 minutes, just sitting there trying to think of what the heck do I want to talk about in this video. I'm committed. I want to put out 2 videos a week, indefinitely. I want to grow this channel, but what the heck do I want to talk about? I didn't really have any ideas. And then I thought about my last patient, and this is what I want to talk about. My last patient today is this guy. I'm obviously not going to give out a lot of information, but it's this guy that's quite unhealthy, overweight, smokes, doesn't really keep track of his diet, even though I've extensively talked to him about everything I want him to do, the low glycemic diet for diabetes, losing some weight, getting healthy, and not to toot my own horn, but this is all stuff that I'm good at. This is all stuff that I know a lot about, being a medical weight loss professional, having the training for that, and also being a freaking bodybuilder, being in the bodybuilding community, talking to people, researching for years and years and years how to lose fat the most effective, healthy, and fast way possible. He's privileged, not to toot my own horn, not to sound conceited about this, but my patients that come to me for weight loss are freaking privileged because they're talking to someone who has as much experience as I do losing weight, the natural way, not just with medications. And then of course with medications that gets supercharged if they do what I ask them to do. So just someone who wants to not just throw pills at them, but wants to listen, wants to work on their lifestyle, do things that work for them with my experience, locking that in and getting them to live healthier, and hopefully getting them off all their medications eventually, and just seeing them once a year for routine blood work. I don't want to see them every month. I don't want them to be sick. I don't want them to be suffering. I don't want them to be on all these freaking medications and just going down the tubes and just being unhealthy, not being able to live a fulfilling, healthy, happy life. I want that for them. I want them to be healthy and to not need me, which is, I think, kind of a unique thing, and honestly a huge privilege to have a provider that cares about you that much, about your growth as a person and about your health, not just freaking popping pills and okay, I'll see you in 3 months. I can't stand that crap. Yeah, some people need that, I get it. I'll see you as often as I have to see you, but I'm not gonna bring you back a bunch of times just because it's good business for me and it's easy. Oh, you're still on your medications? Okay, here's your blood work. Okay, next. That's freaking boring for me, and it's bad for the patient. I hate that stuff. And so I don't practice that way. I practice by actually talking about lifestyle modifications, by actually making people healthy from the ground up. I'm holistic in my approach to healthcare. And that doesn't mean I'm some woo-woo, what would you call it? Holistic healer who says, oh no, you don't need your or you don't need your blood pressure meds, you don't need your sugar meds, just take cinnamon and meditate and you'll be fine. No, that's BS. I don't do that kind of crap. I do what works. I do what works to lose weight, to get rid of metabolic syndrome the natural way. And of course, I use medications to make people safe until they lose the weight, if they ever do. That gigantic diatribe aside, what really frustrates me as a provider, and especially as a provider that puts this much care and effort and time into trying to get people healthy and not just making them pop pills, is when people just do not do anything to help themselves. I understand it's tough. I understand if you've been eating a certain way for 60 years, let's say, for 60 years plus, you've been eating a certain way, you've been eating certain foods, you may have heard certain myths about diet and about health and whatever, that, oh, breakfast is the most important meal of the day. By the way, that's BS. Unless you're a farmer or unless you're on certain sugar-lowering medications for diabetes, you don't have to eat breakfast. In fact, you should not. You should eat as little and as less often as possible, unless, of course, you're on certain medications or you have just a very, very active lifestyle, like you're a farmer or an athlete or something. Again, not medical advice. Check with your doctor. I don't know you. I don't know if it's safe for you to follow my advice. So the disclaimer in the beginning of the video, heed that. None of this advice is for you unless you follow up with your doctor and see if it's safe. But anyway, all kinds of myths that have been in our culture for a long time. Breakfast is important. Totally BS unless you're a farmer or an athlete. You're gonna starve if you don't eat certain number of times per day. Total BS. In fact, intermittent fasting is fantastic, and it's a good way to reduce your calories and lower your weight. And that's, the problem with all this stuff, blood pressure, sugar, all that junk. It's because people are overweight, and you stop being overweight, you eventually get off your meds more than likely. You don't need them anymore. So, where am I going with this? Where I'm going with this is basically, I try to be holistic about my healthcare. And I try to get people to lose weight and just to live healthier. And I understand it's difficult to undo all the programming and all the myths that you've heard about food for, 10, 20, 30, 50 years of your life. it might be very difficult. You've been eating this way for decades, and here I am telling you, hey, by the way, stop eating bread. By the way, stop eating sweets. By the way, stop drinking so much coffee. By the way, alcohol is bad for you. Don't drink more than like 1 drink per day, preferably no more than a couple per week. X, Y, and Z. All this stuff that like people may have been doing for a long time, it's hard to get used to the things that I'm telling them. I have sympathy for that. I understand that it's probably difficult to, undo these bad habits. A lot of people are very dependent on food, not just from bad habits, but, because it's like an emotional thing. It's a crutch. It's almost like an anxiety medication. People are addicted to food. It makes them feel better about whatever, that they feel bad about. So like, I get it. Addiction to food is a big, big deal, and it's very hard to solve. But yeah, so I get that side of it. But it's still, to me, extremely, extremely frustrating when people just will not help themselves, will not even try to do the lifestyle modifications I'm talking about, because I'm putting in all this work and effort and all my experience to try to help them get off their medications, to be healthier, to be happier. And they just don't care. They come back, month after month after month after month, renewing their phentermine, which is a medication that's supposed to be prescribed for a temporary amount of time, not for a long time, not forever. And it's supposed to get some weight off you really quickly, and then that's it, send you on your way. It's not meant for you to be on it for months and months and years to just, increase your metabolism a little bit so that you could eat more. Like, that's what some patients kind of use it for. It's like, oh, I can eat more and not gain weight. Okay, but you're not losing weight. So, as you can tell, I'm very frustrated about that. And I'm very frustrated about people who just will not take personal responsibility and make effort to change their lives for the better, for the healthier. It's not because I'm beating up on them or because I'm making fun of someone for being overweight. Like, obviously not. I've devoted my life and my profession to helping these people. But like, when people will not at least meet me halfway, at least match my effort. In fact, no, screw that. At least match half of the effort that I put into your healthcare. At least match half of that, to take care of yourself. When people won't even do that, I don't know. I mean, all that's left for me is to be like your regular run-of-the-mill medical provider and just check the box and, re-prescribe the medication and order the blood work and tell you, hey, your sugar is not better, your blood pressure is not better, you're still, this much overweight. No, you're not. You're still not making efforts. Okay, roger that. Like, and just, type that up month after month after month after month, and then nothing changes. And to me, that's extraordinarily frustrating, for a guy that values personal growth and responsibility above anything else. That's extremely frustrating. And so nothing makes me happier than when a patient really just takes their health care like into their own hands and does a great job and eventually is so happy with the results that like, oh my God, I'm not diabetic anymore. Yeah, you heard me right. I told 2 people today, 2 people, you're not diabetic anymore. You're not even pre-diabetic anymore. You're done. You're not diabetic. We cured it. We freaking cured it because they took responsibility. That's what makes me happy. And when people just month after month after month will not do anything for themselves and just, I mean, I know where that goes, it's not a good road. Even if you have good genes and you happen to feel okay at 65 years old, with an A1C of 8, 9, high blood pressure, being, 100 pounds overweight, like, just because the person doesn't feel bad yet doesn't mean that something bad isn't coming for them. And there's nothing I can do about it. That's the thing. I can prescribe the optimal medication regimen. I can keep testing and keep, switching around the meds, doing what I got to do my job. But if they won't do their part, even a little bit, I'm totally powerless, totally helpless to do anything to help this person. And that makes me really, really unhappy. But anyway, yeah, not to leave this video off on a bad note. It's still 98 degrees. I'm sweating, as you could probably tell. So I'm going to cut this video off, and I'm going to go to the coffee shop, do some homework, and then I've got a class tonight that starts in an hour. So, yeah, anyway. I'm going to end it here. I don't really know what else to say. Thank you for watching. I'll see you in the next video.